If you've been paying attention, then you should have seen that President Trump has appointed Dr. Mehmet Oz to be the head of CMS. That's the Center for Medicare and Medicaid Services. You probably know him from his Dr. Oz show. Dr. Oz received his undergraduate degree from Harvard University and obtained a joint MD and MBA from the University of Pennsylvania School of Medicine and the Wharton Business Schools, pretty prestigious schools. He was awarded the Captain's Athletic Award for Leadership in College and elected class president twice, followed by president of the student body during medical school. He is a professor emeritus at Columbia University and led the Heart Institute at New York Presbyterian Medical Center with research interests including heart replacement surgery, minimally invasive surgery, complementary medicine, and healthcare policy. He has received numerous patents, including creation of the famed MitraClip to repair heart valves without surgery. So, he is no slouch and certainly no quack doctor, but is he qualified to run Medicare? And regardless of whether he is or isn't, will he make Medicare great again? Personally, I don't think Medicare was ever great, but it has been and is good for most Medicare beneficiaries. In this video, I'm going to suggest to Dr. Oz some very basic and really should be simple things he could do to make it better. Unfortunately, some of those things would likely take an act of Congress. I will suggest some things that should be done, but will be difficult to pull off, and I will also suggest some things to him that he shouldn't do, that he might just do, that will make Medicare worse than what it is now. Hi, I'm Chris Prang, the Medicare analyst, licensed agent in 14 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices. And if today happens to be your birthday, then a happy birthday to you. George Harrison said, "All the world is a birthday cake, so take a piece, but not too much." First, change Medicare supplements to a tiered deductible option. Medicare supplements, also known as Medigap plans, have been around since 1966, and prior to Medicare Advantage were the main option for additional health care coverage. Depending on your age, there are 9 to 12 different Medicare supplement options, and some of those options, quite frankly, are confusing, unpredictable, and have some serious gaps in coverage, especially the plans K and L. Fortunately, most Medicare beneficiaries pick either the Plan G or the Plan N, and a small percentage choose the high deductible G. Since almost 100% of Medicare beneficiaries pick from just primarily 2 of the 9 to 12 options, I'm proposing to Dr. Oz, Congress, and CMS that the current Medicare supplement options be phased out and be replaced with a tiered deductible option with a minimum deductible of $500 per year and a maximum deductible of $2,500. This deductible would apply to any Part A and Part B service. They would never increase due to the Consumer Price Index like the high deductible G currently does. This would allow Medicare beneficiaries to have more freedom and flexibility in choosing their coverage based upon their unique healthcare needs, finances, and philosophies. So the higher the deductible, the lower the premium. It would benefit people with HSAs. The tiered deductible option is also easier for most people to understand. It's simple. Once you've met the deductible, then your Medicare supplement pays 100% of what Medicare doesn't pay. Second thing, eliminate the Part A skilled nursing 3-day rule. This should have been gotten rid of years ago. Your Medicare Part A covers up to 100 days of skilled nursing care, and Medicare pays the full cost for the first 20 days, and then from day 21 to 100, you pay $209.50, unless, of course, you have a Medicare supplement. But there is a very glaring problem with Part A skilled nursing coverage that causes hardship to many Medicare beneficiaries, and that problem is the 3-day covered stay rule. For a Medicare beneficiary to be covered for skilled nursing care, they must first have a 3-day covered inpatient hospital stay. Now, while many people that enter skilled nursing have needed to be inpatient in the hospital for at least several days, it is not always the case. What happens when someone doesn't need to be in the hospital and really needs the skilled care? Well, first, under original Medicare and even with a Medicare supplement, you simply won't be covered and will be responsible for the full cost of your skilled nursing stay if you haven't had the 3-day inpatient hospital stay. Second thing is you could try to be admitted to the hospital. They may not admit you in the first place if you don't need to be there. Or if they do, they may discharge you before your 3-day inpatient stay is up. Ironically, because you may not be meeting the Medicare requirements for an inpatient stay, or possibly because the hospital needs to make room for someone else. Third thing, whereas with a Medicare Advantage plan, you don't need the 3-day hospital stay and can be admitted into a skilled nursing facility directly from your home, your doctor's office, or less than 3 days in the hospital. So I suggested Dr. Oz and to CMS to eliminate the required 3-day inpatient stay. When Medicare started in 1965, according to the NIH report waiving the 3-day rule from 2015, they said, quote, the average hospital stay was 2 weeks, and 3 days represented the minimum time necessary for appropriate evaluation and post-discharge planning. Medicare does not require a qualifying 3-day stay for other forms of post-acute care, including home health visits or a stay in an inpatient rehabilitation facility, unquote. They go on to say, quote, nearly 1 in 5 Medicare-financed acute hospitalizations concludes with a discharge to a skilled nursing facility. These trends raise the possibility that the 3-day stay policy may both inappropriately lengthen acute hospital stays for patients who could be transferred to skilled nursing facilities earlier, and as a result, increase spending on avoidable hospital care and increase patients' exposure to iatrogenic complications. Iatrogenic means a state of ill health or adverse effect caused by medical treatment. It usually results from a mistake made in diagnosis or treatment and can also be the fault of any member of the healthcare team. Third thing, eliminate the pre-annual election period and change the annual election period time frame for Medicare Part C and Part D. The pre-annual election period is from October 1st to October 14th. It is unnecessary, it wastes time, it causes confusion to Medicare beneficiaries, and compromises their enrollment if they send in a paper application too early. Instead, the smarter thing to do is eliminate the pre-annual election period, start the annual election period on October 1st, and have it end on November 30th. This is much simpler and benefits both the Medicare beneficiary and the insurance companies. Fourth thing, eliminate the ridiculous and childish, unprofessional Medicare scope of appointment form requirement. The SOA form is a form that all Medicare beneficiaries must physically sign, electronically sign, or verbally agree to before an agent can speak with them about anything related to Medicare Part C, which are Medicare Advantage plans, and Medicare Part D drug plans. And unless the Medicare beneficiary called in or walked in unannounced, then a Medicare beneficiary has to wait 48 hours before an agent can review plan benefits with them, even if that person is already an existing client. Ridiculous and unprofessional. Meanwhile, an agent can cold call you and even come knock on your door if you're going to talk about Medicare supplements. And you can bank on the fact that some Medicare supplement companies send their agents door to door to market people turning 65. While the form is meant to protect Medicare beneficiaries from being solicited about something they aren't interested in, it does very little to help with that, and it has proven that over time. As an agent, I don't need your signature on a silly form to speak to you professionally and freely about Medicare supplements, long-term care, annuities, life insurance, or any other health-related product. Requiring agents to have Medicare beneficiaries sign the scope of appointment is cumbersome, time-consuming, when a person has to wait 48 hours, and it is truly unprofessional. CMS calls the 48 hours a cooling off period. Cooling off period? I couldn't even tell a Medicare beneficiary anything about a Part C or Part D plan to get them all excited and hot over. What is there to cool off? Nothing, folks. And it is not the small independent agent or brokerage that is causing the majority of complaints to CMS. It is the big telemarketers and 800 number ads. But ironically, if you call an 800 number ad about a Medicare Advantage plan or Part D drug plan, they don't even need to have you sign the form, let alone wait 48 hours. So to Dr. Oz and CMS, I say do away with the SOA. Fifth, very important, dealing with Medicare Advantage. Several parts of this. Part 1, the prior authorization issues. Because Medicare Advantage is more managed care, insurance companies are more likely to either require prior authorization for a treatment or deny the claim outright when original Medicare would not have. Now, there are times when prior authorizations are in fact helpful and do protect the Medicare beneficiary from unnecessary procedures and costs. Thankfully, Congress and CMS are addressing this issue, but more needs to be done. I suggested Dr. Oz and CMS several possible solutions. 1, if original Medicare doesn't require a prior authorization, then neither should Medicare Advantage. 2, if a prior authorization is required by the Medicare Advantage company, and then that treatment were to be denied by the Medicare Advantage company, then if the Medicare Advantage member can get a validating second opinion, then the procedure or treatment must be covered by the Medicare Advantage company regardless. 3, reduce the extra benefits that many people don't utilize and in many cases don't even know they have, and use those savings to help cover treatments and procedures that may have otherwise required a prior authorization or been denied outright. If you look at this chart, you'll see the average Medicare Advantage plan for 2024 offers a combined $8,261 for routine dental, vision, and hearing. and most of that isn't even utilized. And speaking of extra benefits, this is part 2 of Medicare Advantage. Replace any and all extra benefits like dental, vision, hearing, over-the-counter, and the beloved grocery or flex cards with just a simple health and fitness benefits card. As mentioned above, most plans include some extra benefits like dental, vision, over-the-counter medications, and sometimes a grocery allowance. The issue with this is many people don't know they have them. Many people don't want or need those extra benefits. Dental coverage doesn't really help someone with dentures in most cases. Hearing aids don't help people that can hear perfectly fine. These extra benefits are what the corrupt marketers, telemarketers, TV ads, big brokerages love to promote. While they can be nice, you don't get a health insurance plan to pay for your groceries. Since Medicare Advantage plans offer thousands of dollars in extra benefits, since not every Medicare Advantage plan member wants or needs the same mixed bag of extra benefits, the better thing to do would be to simply eliminate the mixed bag of extra benefits and replace it with a health and fitness benefit card that could be used for a variety of health, medical, and fitness options of the member's own discretion. It could be used for routine dental, vision and hearing, over-the-counter medications, vitamins and supplements, medical equipment, alternative treatments like chiropractors, acupuncture, and even cancer. Maybe Medicare doesn't cover an alternative treatment. Well, these funds could be used at the member's discretion to pay for that alternative treatment. Gym memberships, fitness equipment, exercise or fitness class like martial arts, Pilates, dance, water aerobics. It could be used for healthy food and groceries, and even regular provider co-payments. This could make the extra benefits much more efficient to utilize for the member as well as the insurance companies. Think about it. The member would not have to pay upfront and then submit a claim to the insurance company. And the insurance company would not have to deal with claims for these benefits because the payment is going directly to the provider or supplier. Part 3 of Medicare Advantage is reduce the number of plans one company can offer in a region or a state. There are simply way too many plans for people to pick from. According to the Kaiser Family Foundation, quote, in total, 3,719 Medicare Advantage plans are available nationwide for individual enrollment in 2025. And the average Medicare beneficiary will have the option of 34 Medicare Advantage prescription drug plans in 2025. Do we really need that many plans? No, we do not. It makes it more confusing and it entices the bad agents to solicit Medicare beneficiaries to change their plan when they don't need to. I would even suggest that the Medicare Advantage companies offer a nationwide Medicare Advantage plan, one plan available everywhere in the U.S. Simple. The issue is with how Medicare subsidizes these plans. Medicare subsidizes the MA plans based upon a specific capitation rate for each county and city in the U.S. A couple of solutions would be, first, only allow each carrier to offer 2 to 3 plans per area. 2, instead of by county or city, stretch out to a larger geographic area or even to the state. Having less plans would make Medicare Advantage more efficient. It would reduce confusion when it comes to choosing the right plan. It would simply be better for everyone, Medicare beneficiaries, providers, insurance companies, and for Medicare itself. 6th thing for Dr. Oz. Somehow, some way, encourage Medicare beneficiaries to make better health, fitness, and lifestyle choices. Dr. Oz has been, and I'm sure will continue to be, a proponent of having and living a healthy lifestyle. And given that the average Medicare beneficiary is not proactive in taking better care of themselves and making wiser health, fitness, and lifestyle choices, it is perhaps here that Dr. Oz could have the most significant impact upon Medicare and Medicare beneficiaries. You see, despite the overwhelming evidence of why people should make better health and lifestyle choices, and despite the overwhelming information available on how to do so, unfortunately, most people just don't. Using the Medicare system to promote and reward Medicare beneficiaries for taking better care of themselves will not just pay dividends for each Medicare beneficiary that does, it will also pay dividends for the entire Medicare system. If people are healthier, then less people will need avoidable medical care. The less people that need avoidable Medicare, the more money that Medicare will save. And the more money Medicare saves, the better off we all are. Just look at this from the CDC. Quote, an estimated 129 million people in the United States have at least one major chronic disease like heart disease, cancer, diabetes, obesity, or hypertension, as defined by the U.S. Department of Health and Human Services. 5 of the top 10 leading causes of death in the U.S. are or are strongly associated with preventable and treatable chronic diseases. Over the past 2 decades, prevalence has increased steadily, and this trend is expected to continue. An increasing proportion of people in America are dealing with multiple chronic conditions. 42% have 2 or more, and 12% have at least 5. Besides the personal impact, chronic disease has a substantial effect on the U.S. healthcare system. About 90% of the annual $4.1 trillion healthcare expenditure is attributed to managing and treating chronic diseases and mental health conditions, unquote. Amazing. There is an article on the Sensible Medicine Substack by MD, PhD, Frederick Schultz Buchholzer. He is an assistant professor at the University of Southern Denmark. He stated, quote, "The U.S. is the richest and most powerful country in the history of the world, and this position has been consolidated in recent years. Although the country might fall into a spiraling debt trap soon enough, the U.S. outspends every single major country on healthcare, investing a much larger proportion, 18%, of a much higher GDP. Yes, there is a very high unexplained excess mortality among Americans. Up to 70 years of age, the all-cause mortality rate is 4 times higher in the U.S. versus comparable countries of the Western Hemisphere. As another example of how extreme an outlier the U.S. is, the life expectancy is markedly lower in the U.S. versus the U.K. for every income distribution except perhaps the top 1%, where it is the same. These are incomprehensible and completely unacceptable differences. Yet, it seems that the U.S. public health authorities has simply accepted this as a state of affairs rather than trying to produce what can explain this absurd disparity in health outcomes. There are probably several causes, and some possible explanations are the higher use of pesticides such as glyphosate, additives in processed foods, which Americans overconsume, but the English also get a lot of, ultra-processed food, seed oils, unequal access to healthcare, and overconsumption of medicines and vaccines, unquote. So if Dr. Oz could somehow use his position, his influence, his notoriety to put in place systems and programs within Medicare that would lead to more Medicare beneficiaries being in better long-term health, that would be a huge accomplishment and could end up benefiting millions of older Americans. Quite frankly, we'd all be better off, but this will be a very hard task for sure. Okay, last thing, what Dr. Oz and CMS should not do. Dr. Oz should not make Medicare Advantage the default option for Medicare beneficiaries. A while back, I did a video about Project 2025 and its proposals for Medicare. One of those proposals was to make Medicare Advantage the default option for all Medicare beneficiaries. From what most studies conclude and what I personally found with my Medicare Advantage clients, most Medicare Advantage members are satisfied to very satisfied with their Medicare Advantage. While I am pretty neutral on Project 2025's Medicare proposals, on this particular one, I am not. As I said then and will say now, as Medicare Advantage is right now, no, it's a very bad idea. What happened to choice and freedom? I think most people with Medicare Advantage have no idea what they really have and don't have. Making it the default option will only make it worse, and it will likely cause a mass exodus of providers dropping out of Medicare Advantage networks. Now, if Dr. Oz, CMS, and Congress and the insurance companies could truly create a great government-funded but privatized Medicare Advantage health insurance program, then and only then might it be the right thing to do and make it the default option. But to do this, you would want a population that is much healthier than it is now. Plus, you would have to have all the major and specialty hospital systems on board, the majority of providers and the AMA on board, the pharmaceutical companies on board, the insurance companies on board, the majority of Congress on board, and of course, the majority of American citizens on board. Good luck. All right, that's it for today. I do hope that you found this helpful. I'd love to know your thoughts, so put them in the comment section below. And I do ask that you keep them clean and non-offensive. If you have any questions about what I've just gone over and when you are ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I'll do my best to answer any of your questions that you may have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice and, of course, be available down the road for your support. To stay up to date and gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prying, the Medicare analyst. Make it a great day.